My name is Dr. Leonard LADO. Thank you for coming back and listening to this channel. Today I have a very interesting and important topic that you may have heard of: medical marijuana, also known as cannabis. You know, when this became legalized in the state of Florida, I was very skeptical in joining the bandwagon of prescribers. Yet, I know many colleagues who are non-psychiatrists who basically have now licenses to give this medication. But what do we really know about marijuana? What do you know if it really works or not? And this is what I'm here for. The mind hijacking is to not let you into the path of lies, that it is a do-all and end-all medication to help people without knowing the consequences. Just because it is legalized in the States, it doesn't mean that it works. So today's chapter and today's title is to help you understand and dispel the truth and the fiction. I don't want your mind to be hijacked and fall into this trap. First, I'd like to give you a little historical background and some information of what we know and what we don't know. Cannabis, also known as marijuana, is widely used as an illegal drug, estimated at 178 million people in 2012. The United Nations Office on Drugs and Crime, just this year alone, came up with a very valuable report that about 188 million users in the world were using marijuana. Marijuana has been used since 8,000 years ago by countries such as China, India, and the Middle East. Cannabis was introduced into Europe in the 19th century by Napoleon when the armies came back from Egypt. It was also not until the 1930s that it was introduced in the United States in the board of Mexico, where basically jazz singers would bring it in. However, it was not until 1961 that the drug was banned in the United States. However, in the year 2012, marijuana recreationally was approved by 2 states, Washington and Colorado, and subsequently was approved in Alaska in 2014 by Alaska and Oregon. But so what do we know about marijuana? Okay, we do know that it has some therapeutic values. Number one, it helps pain. It's been known to help seizures. It's been known to help certain disorders such as Tourette's syndrome. It also seems to help Parkinson's disease and seizure disorders. And it's also a very valuable drug with people who have a wasting syndrome of HIV and cannot eat. It's been used in glaucoma. But what do we know about this drug? In contrast, current evidence supports a minimum, if anything, on the use of certain drugs. Even though these things have been indicated for these conditions, there's no actual facts or research to see how they actually work compared to other treatments. You know, marijuana has some very severe adverse consequences. One of the things we have seen, even in the population who have been addicted, is that there's a decreased ability to think and become motivated. In fact, we call it the amotivational syndrome. Among youth and heavy users, when they use it at least 4 times a day or multiple times a day, approximately 9% of the adults and 16% of the use of young men develop an addiction to this drug. Problems in school performance and issues with school and car accidents and risk-taking behaviors, especially in the adolescent population. And by risk-taking behavior, we talk about condomless sex. They have an increased risk of getting HIV and other venereal diseases. The use of cannabis, if you're 50 years and older, have been found to exhibit more problems with psychological distress, suicidal thoughts among people who use these drugs. So, how is marijuana associated with mental illness? It appears that social anxiety seems to develop is the motivation of the use of this drug. But even though you may have social anxiety and you use cannabis, that symptom can get worse. It appears that cannabis use makes depression worse. You also have an increase of risk of schizophrenia. It'd be interesting to find out the countries that use marijuana, countries that have been using marijuana for many years, such as Jamaica. We don't have any statistic as to see what happens to the population in those places. So as of March 2019, Medical marijuana has been used in 33 states, including the District of Columbia, Guam, and Puerto Rico. And New Jersey has been approved for anxiety. Remember, there has been no good trials or good founding trials to stipulate that this is actually an effective treatment. And I can tell you this from personal experience and professional experience. I have people who get prescribed marijuana by non-psychiatrists, and they come to the office sometimes much worse. It is also approved in autism in various states. It's been approved for agitation and Alzheimer's in various states. Cerebral palsy, generalized anxiety disorder that doesn't respond to traditional medicine. And then again, I have seen the failure of it. It is used for post-traumatic stress disorders, something we call a post-concussion syndrome, Tourette's syndrome, and traumatic brain injury. Mind you, even though there is an approval, there's not enough founding studies to show that this is effective. So let me tell you something about marijuana. The marketplace has been flooded with 2,500 strains of marijuana. Some of them are known as Mango Kush, Skywalker, Purple Haze, Purple Skunk, Obama Kush. They have so many names in the forms of edibles. So you walk into the shop, for example, whether it be in a state of Las Vegas, whether it's Colorado, and you are introduced to all these products. And remember, the issue of vaping has become a very dangerous thing these days because there's no quality control of these products. Remember, these products, even though they're legalized, they have not been studied or reviewed or for quality assurance. And this is what the purpose of the Food and Drug Administration does, is to make sure that these products are safe and effective. The best example of something that's went bad to wrong to fatal are the vapes. The vapes have been found to be very problematic in causing death. It was never approved by the FDA. So marijuana, so you understand, refers to the flowering of three main species of cannabis: cannabis indica, cannabis sativa, and cannabis ruderalis. There's about 55 active compounds. Medical marijuana is something that is mixed from these hybrids to become a product that we use. There's something you probably heard of, CBD. CBD is a product of the marijuana, but it doesn't have the hallucinogenic. Again, the effects of CBD have not been studied. I always ask pharmaceutical companies, and yet people who have these products, to sponsor studies so we can help people in the population understand what this is all about. We don't want you to be hijacked into believing that this is going to cure you. Medical marijuana is sometimes considered containing about 20% content of THC. Now, why is marijuana effective? Well, it appears that our bodies have receptors, which is called the endocannabinoid system. And these receptors are present in our bodies. The endocannabinoid system seems to be present almost everywhere. Among the places that you will find them, it seems to improve sleep, appetite, pain, inflammation, reproduction. They appear to be part of many tissue systems, which is a very curious thing. How do we get these? But they're there. What I'm trying to tell you, that people, it appears that people who use these drugs doesn't mean it's going to improve. It seems to be helping. We have yet to see the studies come from pain. We have to see studies to see how it affects anxiety. We don't want your brain to be hijacked into believing that this is going to be the best thing for you. You know, I am always very cautious when something so good moves so fast. You know, it was pushed by a lot of public policy. It was pushed by a lot of lobbying. I have not yet become a prescriber for marijuana. There's no studies out there. However, some people will swear by its benefit. But again, nobody knows what it's going to be 5 or 6 years from now. I do believe that people with very severe illnesses such as epilepsy, people with HIV that cannot eat, glaucoma, and certain illness that have legitimate uses is something to be thought after. I also would recommend or suggest that these plants be more monitored, or else we're going to have the same problem that we have with the vaping. Always remember, the purpose of this channel is to become you a better consumer so you can make better choices. The internet is loaded with misinformation. I hope that this information will help you. You can always look at my background and the link below so you can know a little about what I have done in the past. And the reason this is important, the person providing you with the information that you see on the internet, always check their credentials. What kind of work do they do? This is one way you find out the quality of the information that you're getting. Always, you cannot assume that something is out there is always true. As always, I'd like to thank you once again, and I hope that this information has been very valuable to you so you can make better choices into the future. Always like and subscribe, and please keep giving me feedback. I want to educate you, become a better patient, a better consumer, and above all, a better person in this process we call healing. Thank you, and have a great day.